When I was in high school, my mom was a bit of a hypochondriac. She was always saying that you have to wash your hands before every meal, always wear sunscreen. She was very concerned about my health, which was cool, except that I was at the age where I was still undestructible. And so I always thought that, the worst thing that could happen was that I would die and it would be a really cool explosion. But that was all that I had to worry about. And yeah, I remember one time, the first time I cut myself shaving, she said, "What?" She demanded to know, "What implement did you use on your face?" Uh, she always had a very big vocabulary. She would call things implements when they were just razors. And so, in the summer before my senior year of high school, we're all on vacation at Lake Michigan. And I'm dragging a metal canoe through the lake onto the beach area. And a wave bumps the canoe, and the edge of the canoe scrapes my knee ever so slightly. And my mom sees it, and of course she makes me wash it out, put a band-aid on it, cover it with antibacterial ointment, make sure that it's all cleaned out. And I'm thinking, yeah, all right, mom, whatever. I'll clean it out. And then it's cool. It's fine. A couple weeks go past, summer ends, cross country season begins. I'm running cross country every morning. We get up. It's in the sunrise. It's dusty because we live out by the wheat fields, and we're running every morning. And one morning I noticed that my knee kind of aches from the inside. It's like I got a sunburn on the inside of my knee, just a little tender, a little inflamed. And later that night, I noticed there's like a bug bite or a pimple at the top of my knee. And as I squeeze it, drain it out, it looks to be okay. But every day as I run, it keeps aching, and the pimple comes back every day, and I keep having to drain it and get rid of it. And then one day I'm standing in the kitchen, and my mom notices that I'm shifting my weight from one foot to the other because my knee still hurts. And she asks, "What's going on? Are you limping? Is your foot hurt? Why are you moving around?" And so I show her my knee, and she gets down and she looks at it closely, and she freaks out because apparently by that point it had progressed from just a pimple to just this open sore that was oozing clear mucousy snot or something. And so she freaks out, and she makes me go in the bathroom and clean it out. And so I'm sitting down on the bathroom floor, poking and prodding at my knee, which has become swollen by this point. The skin is like red and raw, like your cheeks get when you're outside in the cold. It's like that raw red skin. And I'm squeezing it and massaging it. And suddenly, this wave of orange goo just like spills out of my knee like a volcano trickling out lava. And it's like the Chick-fil-A sauce that you dip your fried chicken in. It's this orange goo. It comes out of my knee, and I immediately get my iPhone to start filming this because it's insane. And I clean it all off. I'm filming it as it's happening, and then I keep squeezing, and then these white chunks of cream cheese pop out. Like they become airborne, and they land on my shin, and they bring with them these little droplets of blood that are sort of, dot, 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 as there's a trajectory that's spurting out over my shin, and they land on my leg. And so I go back to my mom, and I describe to her what happened. And she freaks out, of course. She says, "We have to get you to the doctor right away." And so we go into the doctor. Doctor's looking at my knee, and he says, "Okay, you have an infection. You have MRSA, methicillin-resistant Staphylococcus aureus in your knee, and it's infecting the thing called the bursa sac. It's where if you get bursitis, it's the inflammation of the bursa sac, and it's very serious." And all I'm thinking is, I have MRSA in my bursa. What is this, Dr. Seuss? I have flies in my eyes, and fleas in my knees, and mucus flows in my nose. I have MRSA in my bursa. The doctor did not find that funny at all. Neither did my mom. And the doctor said, this is really serious. If you'd waited just a day or two before coming in to see me, it could have infected the inside of your knee and it might have required surgery. It could have done permanent damage to your knee joint, something possibly not even able to walk for the rest of your life. And this is the first time that I realized that there were bad things other than dying that could happen to you. You know, I thought that either you live or you get in a car crash and you die, but it never occurred to me that you could be hurt and then live another 60 years with the hurt still being there. And so the doctor gave me meds, antibiotics. He was able to clear it all away. I had to stop running for a couple weeks, but it went away, and my knee was fine, went back to normal. But from then on, throughout the rest of senior year in high school, whenever my mom and I had an argument about cleaning my room or going to bed on time, she would always hold that over me. She would always remind me of the time that I didn't listen to her and that I got MRSA in my bursa.